The following portion of Living Local DMV is sponsored by Ashburn Children's Dentistry. Welcome back. It's my favorite time of the show. Today we're diving into the impact of pacifier use on overall oral health and development, from benefits to potential risks. And here with all the practical advice for your child's healthy growth are our resident mother-daughter dynamic duo. Dynamic, always dynamic. Doctors Linda and Crystal Dean Daru. Welcome back to the show, ladies.
Thank you.
And this is a question I was telling you all during the commercial break. People stop me like on the street, like, can you ask the doctors this? Can you ask the doctor? I'm like, sure, I definitely will. Are pacifiers more harmful than they are beneficial, and is there an age cutoff?
So that's an age-old question. So pacifiers, I'll say they're in between. They have some benefits early on. They can soothe the fussy baby, and they can help with sleep, to help with kind of preventing the sudden infant death syndrome very early on. And for some premature babies, it can help with developing that sucking reflex for them. So very, very early on, I'll say in the first few months.
How many is few, like 3?
About 3 to 4 months.
Okay,
and latest 6 months.
Gotcha,
Yes.
gotcha. Then we got to say goodbye to the passy.
You've got to start the weaning off. Yes.
Oh, understood.
Yeah.
I saw a video go viral where somebody put the pacifier on a balloon and let it float away from the baby. Oh. That's a little bit traumatic, but who knows?
Right, we want to reduce that.
Yeah, reduce the trauma, for sure. Dr. Linda, what are the ways, some guidelines to use the pacifier safely?
Well, again, just like we were saying, sometimes they're necessary to use, but the most important thing to remember is that if the tongue function was well and the baby was born full term, you really don't need a pacifier. However, between 0 to 6 months, if you had to use them very rarely. Just calm the baby when they're fussy and then take it away. And you don't want them to lose their sucking reflex from there, or even miss their chewing cues and crying cues for hunger as well. And by the time they're 12 months of age, you really should be getting rid of them as well, because by that time the teeth are starting to come in and you could mess up how their jaws are growing, and they can have more crowding on them, more what we call open bite, or deep like cross bite, where the top jaw is narrower than the bottom jaw as well.
Very important. And we saw the full screen there going through the different ages and when you should be weaning. Dr. Crystal, I would like to ask, because I brought in my baby to you all, and you all had something that was similar to a pacifier, but probably a little bit better. Tell me more about that.
So this is what we say to try to do, try to get some chewing toys. And this is called, what you're referring to is the munchie baby.
Yes.
Or the My Munchie. The munchie baby can be introduced at the age of, a few months old, probably about 5, 6 months, even earlier than that. And what that's doing is not only stimulating the gums and stimulating the mind, but is also stimulating that chewing reflex. And it can be a replacement for a lot of pacifier use that goes beyond that 6 months. You really want to try to figure out why the baby or why the child is so dependent on the pacifier. Right? So finding different things to replace it, soothing, singing, things like that, and just trying to figure out what's going on and why they actually have to soothe with a pacifier is important. And then the munchie baby is like extremely, very, very useful, because that in and of itself is helping the jaws grow too.
Very, very essential. And the first thing I thought about is if everybody could have Dr. Linda at home with them to sing to their babies, because it is I'm telling you,
It's an experience.
It's an experience. I'm like, I want Dr. Linda to sing to me. So everybody's got to come visit you just for that alone. And then one more question I had about the pacifiers. Is there a way that you would advise parents, like, you know what, they can't live without it? Do you just take it step by step?
Oh yeah, this is one of those things where you cannot judge a parent. It's a traumatic thing if you do the cold turkey. Right. So even when you mention them tying it to a balloon, if you have a ceremony for it, or have a gift exchange, or
you get this, you get the munchie baby instead.
Exactly. You get the baby munchie instead. You start finding ways to replace, and then like I said, if it goes past the 12 months and there's still dependency on it, definitely want to consult professionals to try to figure out the root cause of that, because it's something else.
Yeah, especially if they have the pacifier that's attached to a toy. You really want to cut the toy off from there, because that's also affecting a whole lot more about how their jaws will grow.
Well, next time I want to talk to you all about babies who chew on Amazon remote controls, because that's what's going on at my house right now. Thank you so much. And as we mentioned, pacifiers can be a helpful tool that babies need to use wisely. Thank you to Drs. Linda and Crystal Dean-Duru sharing these valuable insights. Parents, if you'd like to know more information and personalized advice, you can head to their practice or visit the website for resources on the QR code mentioned on the screen right here. Ladies, thank you again. Again, we're going to talk about remote control chewing next time.
Yes, we can't wait to see Princess.
Thank you.
Thank you.
The preceding portion of Living Local DMV is sponsored by Ashburn Children's Dentistry.